Hi out there in YouTube land, it's Lisa, and today I'm creating a video that explains a lengthy video that I made over time about my gender confirmation surgery this past December. It's coming up on 6 weeks post-op, and I'm doing wonderfully. No regrets. And I couldn't be happier. I'm female through and through now, so there should be no question to anybody. But of course, you always get your haters. And if you've noticed, this lazy eye, maybe it's the other eye sometimes, it's not because I'm tired. It just has to do with who I am and the way I react. Anyways, I'm a very happy person, and as you can see, my sign behind me, if you can read it okay, love is all you need. And I truly believe that. If this world had more love in it, it would be a truly wonderful place. So I digress. Moving on. I wanted to explain just a few things about the video that you're going to see. It was taken over several days, starting back on December the 12th. On that day, I was expecting to have my gender reassignment surgery, my GRS, with Dr. Thomas Satterwhite. I went to sleep, I went under the anesthesia, and I awoke and it hadn't been performed. I was quite distraught, as you would imagine. A ball of tears. My sweet, sweet love tried to console me, but there just wasn't any consoling at that moment. My doctor came in, Dr. Satterwhite. He hugged me. I want to cry to think about it. He kissed me on the cheek, and he whispered in my ear that I should not be concerned, that they just needed to check out something abnormal they found, and that once that was cleared, I would have my surgery the 24th, which was Christmas Eve. Apropos, I couldn't have asked for a better Christmas gift. Anyways, it was a long week and emotional, ups and downs, but the week passed and I came back and morning of December 24th, I went under anesthesia again and woke up completely a woman. Now, I know you all say, as my loved one says, you've always been a complete woman. And in some sense, that's true. But those of you out there that are waiting to have the surgeries, and those of you that have had the surgery, you know what I mean. It's just that confirmation that your body matches my mind. I'm 54 years old. And I've been in this torturous mind-body situation almost that entire time. My memories go back to 3 years old. Some years may go back earlier, later, doesn't matter. Just know that it's possible. So now, I'm all woman. So, on with some more explanations. Waking up from surgery was a bit of a fog. I don't remember my initial waking, although there's video of it and you will see it, but I don't remember it. But later that day, I started to be very much awake and very much aware that the surgery was completed, and I was overjoyed. I couldn't tell you how happy I was, regardless of any discomfort I was in. And might I add, it wasn't any severe pain at all. The medications they give you, at least for me, just wasn't that bad. It wasn't that big of an issue. My main thoughts were, it's done. My body's finally right. The second day, I definitely walked the second day. Walked around the room, and then I sat back down and tired, and it's a bit uncomfortable. You've got all that packing down there, okay? Later that day, I think it was, I walked out into the lobby area, or out into the nurses area, and took a lengthier walk. And then the following morning, I took quite a lengthy walk throughout the upper floor of the hospital I was in. And later that morning, the doctor came in and said, "Would you like to go home?" Well, of course I want to go home. Who wants to stay in a hospital? And I was feeling pretty fair. So I went home to my uncle's home, which is up in San Francisco, very close to where my doctor's practice is. So it worked out wonderfully. I laid in recovery, and just for the first, whatever days, 3, 4, 5 days it is before you go back for your first post-op, you just kind of lay there. I mean, you have a catheter, and you don't have to go to the bowel. You've already cleaned yourself out, so you're not taking any really solid foods. You just don't have them. Not to get graphic, but there wasn't any issues, okay? I did get up and walk around, but other than taking care of myself, just a sponge bath maybe, but that was it. I just laid down for several days. Once I did go to my first post-op, that's when the magic happened. And that's when reality started to kick in. They removed the packing, which I explained in my video, and it was beautiful. It was so beautiful. I was so happy. To me, it was the most beautiful thing I'd ever seen. And it just gets prettier every day. And my sweetheart was there with me again. And then the doctor sent me home after explaining how to dilate. And so the dilation begins. And let me tell you, girls, that's a lot of work, okay? It's something that isn't spoke of near enough. If you take this challenge on, which, if you're like me, you had no choice, it's this or, a very, very dark life. So my choices weren't, I had to do this. But please take it very serious and take care of yourself. Keep yourself clean. Follow the doctor's instructions. In my case, I missed one of the instructions about icing it up, and that may be of help to you. Check with your doctor, of course. Anything I have to say, please check with your doctor. But take the medications they give you, and do the dilations as prescribed, okay? Don't be afraid of it. It's a bit uncomfortable at first. Actually, it's still a bit uncomfortable, to be perfectly honest. But it does seem to be getting better. And someday, if you have a mind to, it will be filled with something much more enjoyable. Not to say more than that, but I think you know what I mean. So you need to take care of yourself, so that all that hard work the doctor put into you will last. I've spoken about, my first bathroom, successful bathroom, bowel movement and urinary episode, and it's a very good feeling to have them both work, I must say. I did leave San Francisco early, which is, I don't think it's typical. I just heal very quickly. I left before my third post-op, which was scheduled in a week from the time I did leave. I was having some housing issues, and I talked to the doctor, and he was in agreement that I was doing very good and that I was ready. And I'm being seen by my own private physician now, here back in California where I live. And that is going wonderfully. I've seen her once so far, and in a couple of days I'll see her for the second time. Issues post-operatively up to this point have been minimal. Very little post-operative bleeding. Dilation, pretty typical, I think. I've migrated up to the blue dilator, which is the second level. I just felt that the initial one, the purple one, had run its course, and that I needed to upgrade. So I did that, and without any episode. The way I do it, and there again, ask your doctor if it's okay, but I use my purple one, the first one first, for just a brief time, a minute or two, and then I change out to the blue one, and that seems to be the best for me. It doesn't cause me any discomfort that way, other than the normal. I've tried to insert the blue one by itself, and it just seems a bit tight still. So when I do it the other way, it seems to go quite well. Be sure you keep everything clean. I was talking to a girl the other day, and in case you didn't know it, you can get a urinary tract infection, I guess, so it's not fun. So keep yourself clean, wipe in the directions that you've been instructed, keep all the nastiness away from each other, keep them apart, yeah, just take care of yourself. Take this serious, okay? I know it's going to get not monotonizing. It's going to take a lot of your time. It's going to tie you to your home. I could go on and on. It can be very, very tedious. Make a game of it. Study something, watch a television show, read. Just make some use of the time instead of laying there, which is what I do. And to let you all know, I have a scheduled wedding in November, so please all wish me luck. I love this man with all my heart. He's been by me through the whole process for the most part. To backtrack just a little bit, I started my process on July 15th of 2013. I believe that's kind of a very quick process. It's abnormally quick, but my age has a lot to do with that. I've been planning this for my entire life. I've read everything I can about it. The internet came along and just opened my eyes and filled my head with all the information I needed to progress this and make this happen. And then once my insurance company, which is Blue Cross, agreed to pay for this surgery, which I wholeheartedly agree. This is a necessity for us. Psychologically necessity. It isn't our fault that we were born with a female brain and a male body. It's not our fault. For heaven's sakes, world, listen. This isn't a choice. Who wants to go through this? Who wants to put their families through this? Who wants to put their bodies through this? It's so important to those that truly suffer on an understanding that this is a necessity, or they're going to lose more and more wonderful people, men and women, just because they have a dysphoria between their head and their body. I'm not a therapist or psychologist, so forgive my terminologies, but you know what I mean. You get the gist. I'm so happy now. I want to keep telling you because it's true. And I'm looking forward to a wonderful life with my future husband. And his family loves me, and I love them. And those of you in my life that are watching this now, I love each and every one of you more than words can say. And those of you that stuck by me, you're special people. You're special people, and you're number one in my book. And those of you that have left me, which are few, and you may see this, I miss you, and I forgive you, and my arms will be reaching out for you if you ever want to be back in my life. So enough of that sob stuff. I guess that's all I have to say. If you have any questions, please just send them to me, and I'll do my best to answer them, as long as they're discreet.